Hi, everyone, and welcome to the Leaders in Aging Network's advocacy training for nonprofit organizations. We're going to get started in a few minutes. It looks like there's still a lot of people joining at this point. So what I'm going to ask you to do while we're waiting for a few more people to hop on is I'm going to ask you to go down to the questions or chat box. And because we have so many people attending from so many different areas of both Kansas and Missouri, I'm going to ask you to type in the chat or question box what organization you're from and what state or area of the state that you're in, so that people can kind of see what other organizations are here and get to know each other a little bit. And again, we'll start in just a second here. We've got a lot of people joining still. All right, it looks like we've got Topeka, Kansas City, Joplin. We've got Cape Girardeau, Blue Spring, Missouri, Olathe, Kansas. All right, it looks like we're slowing down a little bit down now, so I think we've got most people joining, so I'm going to go ahead and get started. So welcome, everyone. My name is Lindsay Baker, and I'm the Research Director for the Missouri Budget Project, and also a member of the Leadership in Aging Network that organized this webinar. So today, we're going to be hearing from a couple of really great speakers. We're going to be hearing first from Jessica Hembre with Platform Civic Strategies, and she's going to be walking us through how to better engage policymakers in our advocacy. And then we're going to be hearing from Marcy Phillips with the National Council on Aging, who is going to help us understand how to better advocate digitally in this age where we can't have those face-to-face meetings and interactions that we would normally rely on for our advocacy. So we're really lucky to be able to hear from both of these speakers. Before I throw it over to those speakers, though, I wanted to go through a few things to kind of help set the stage for why the Leadership in Aging Network thought it would be a really good idea to put on this webinar. And that's really because even though advocacy is always important, right? It's always important for legislators to hear from their constituents and to hear from those people who are kind of on the ground talking or working with seniors and older adults directly in order to better understand what the needs of those seniors are. That's always important. But right now, I would argue is in a critically important time because of what we're all going through right now. COVID-19 has kind of laid bare the inadequacies and inequities that already existed in our current system. And, make no mistake, the next year or two is going to be especially difficult. And that's obviously partly because of the virus directly is going to make our work hard. But on top of that, I think what's really important to keep in mind is that we're also simultaneously going to be experiencing a recession on top of the virus itself and the effects of that recession. And what that means is that need across all of our communities is increasing dramatically, whether that's need for healthcare or need for food assistance or need for any of the other services that people rely on across our states and across our cities. But at the same time, the revenue that supports those services, whether that's sales taxes, personal income taxes, corporate taxes, that revenue is declining because people aren't out spending money at businesses, people have lost their jobs, and businesses haven't been able to open. So what that means is at the same time that need is increasing, the ability for states and local governments to meet those needs through services is decreasing, at least in a funding capacity. And so, I think it's an incredibly important time to begin to think about how do we better advocate for those programs and services that we know work and that we know are going to be important during this time. So In the next few weeks alone, we're going to have the chance to weigh in on the next federal relief packages that are going to be put out by federal legislators, including state and local fiscal relief, enhanced Medicaid funding. On August 4th, Missouri voters are going to have the chance to weigh in on Medicaid expansion, which would bridge the healthcare gap for 18,000 seniors, provide healthcare to low-wage essential workers, and potentially provide shore up the state budget by leveraging additional dollars. And moving ahead, there will be sustained need for additional advocacy in order to prevent cuts to services for seniors across our state, as those state budgets and local budgets become increasingly stressed due to this decreasing revenue that we're seeing. And so it's really, an incredibly important time for advocacy, and it's imperative that the needs of older adults and their caregivers are communicated directly to those legislators who are going to be making decisions on them. And so we're incredibly lucky to have two speakers with us today to help us navigate those waters and be able to more effectively communicate the needs of those older adults to those legislators, and to make our advocacy efforts more targeted and more effective. So before I throw it over to our speakers, I do have a few housekeeping items that I want to walk you through. So first, I want to send a big thank you to our sponsors for this event. Again, the Leaders in Aging Network has organized this webinar, but our sponsors for this webinar are AARP Kansas, AARP Missouri, and Casey Communities for All Ages. So we want to send a big thank you to those groups for making this possible. I also want to let everyone know that this webinar will be recorded. So an email will be distributed with the link after the webinar, so everyone will be able to see this and go back to the webinar with any questions you might have. The last thing I want to tell you before I throw it over to Jessica is that we will have time for questions and answers, but we are going to hold those questions and answers until after both of the speakers finish. And so we're going to let both of our speakers go through their presentations, and then we will open it up for questions. And the way that we are going to handle that, because there are so many people on this call and we know there are going to be so many excellent questions, is that we are going to have you type into the question or chat box what your question is, and also, if applicable, who that question is directed to. And then I will be relaying those questions directly to Jessica and Marcy. And then they will answer those, as many of those questions as we possibly can in the time that we have. And so that's the way that it's going to work. Those questions will hold in the question box. So you're welcome to submit those as you think of those questions, again, in the question or chat box, and we will get to those questions after the two presenters have finished. And so without further ado, I'm going to pass it along to Jessica Hembre. She's going to be our first speaker. Jessica is principal of Platform Civic Strategies, a consulting firm that provides nonprofit and philanthropic organizations with two key services: strategic planning for public change and designing public advocacy efforts. In this role, Jessica has helped incubate ballot initiatives, facilitate federal planning processes, and conduct multiple strategic planning engagements. She has 20 years of experience in policy change, including 10 years as a policy director at the Health Forward Foundation, or what is now the Health Forward Foundation in Kansas City. So Jessica, we're excited to hear from you.
Thank you so much, Lindsay. I'm going to go ahead and get some slides pulled up here and dive in. I will tell you guys that I am a super move around the room kind of presenter. So if you see me flailing my arms around, that would be because I am trying to get all my energy that I typically use in a presentation out in this online format. So let me pull up these slides and dive in. So just for some context, as Lindsay mentioned, I am Jessica Hembre. I run my own small business, and when I say small business, I mean a very small business because it is just me. And I focus really on the intersection of politics and policymaking and nonprofit organizations. It's my absolute passion. I've gotten to work on so many projects that I absolutely adore. I'm working on the Medicaid Expansion Ballot Initiative on behalf of the Health Forward Foundation. I worked there for 10.5 years as their policy director and registered lobbyist in Jefferson City. I've been really lucky to be involved in projects with the American Heart Association on tobacco issues, with some rural organizations. I've just loved the work I've gotten to do. Simultaneously to starting my own business here, I ran for the school board, so I'm actually on the school board in my community in Shawnee Mission School District, and that has given me a whole kind of new and different perspective on what it means to be in the advocacy arena and what it means to engage policymakers. I had my own thoughts about what that looked like when I was an advocate, and now that I'm technically I guess a policymaker myself, I have some even additional insights that I'm excited to share with all of you today. So we will dive in. I want to start, I think it's really useful to just zoom out and really think about why we even care about this question of advocacy. I know so many folks on this call are with nonprofit organizations, and nonprofit organizations are sort of famous for having these really idealistic and grand mission statements and visions of what they're trying to achieve. And I think these aspirational goals are fantastic, but if we really take a step back and think about them, so frequently nonprofits are existing because they are trying to solve or fix or remediate or put a Band-Aid on what is oftentimes really, really structural issues. So I think that changing the policies and systems and rules and environments that people are living in is one of the most important things that nonprofits can do to really deliver on their mission. So I want to take just a second here with so many folks on the line and like I said, I'm a super interactive presenter, so I'm going to try to make this as interactive as possible. If you wouldn't mind taking a moment and just sharing in the chat box or the questions box, whichever one you have, I think different people have different things, what your organization's mission statement is, because I want to see what we're all existing to do, our organization. I'll take a moment for folks to do that. All right, I'm seeing some stuff come through here. Looks like we have a lot of area agencies on aging. What would the mission statement be for an area agency on aging? What is your organization's reason for being, the big grand vision you have? I see serve the over 60 population, to stay in their home, stability and self-sufficiency, poverty, seeing each person as an individual, but also an individual that lives within a context and an environment, assisting and providing information to seniors, helping people stay in their homes safely. So keep rolling those in. I think it's important when we think about all of these to really acknowledge, especially as we think about the older adult population, how much of well-being for the older adult population depends on all of these things that are actually policies and systems that are happening outside of your own organization's four walls. So something like Medicare policy, that matters tremendously for the health and well-being of older adults, and it's not something that any one organization controls that issue. Affordable housing, access to community supports, all of these things have really incredible impacts on outcomes, but they aren't just the service delivery of your nonprofit. So I think if we really dig deep and think about the mission statements of our organizations, we have to acknowledge that these policies and systems matter tremendously. And I think what I really want folks on this call to know is that from the perspective of so many policymakers, they hear all the time from so many different people, many of them with a dog in the fight, many of them who run a long-term care facility or run a hospital or have kind of financial reasons to be approaching policymakers. But all of you and your organizations as nonprofits, you are at the front lines of these issues, and your vested interest is oftentimes only seeing your mission be achieved and serving your clients better. So when you have these conversations with policymakers, they really listen. Your voice matters so much. I think there's a lot of fear and intimidation in engaging in this policy and advocacy space, but I want to assure you that a little can go a long way, and your voice really, really matters. So a big part of what I want to do with this piece of the presentation is just help to develop a comfort level in engaging with policymakers. I think we have an idea in our heads sometimes that it's only something lobbyists can do, or it's something that requires being super attentive to every single bill that's out there and knowing all the lingo about due pass and third read and sine die and all of this stuff. And ultimately, you are the experts on your issues, and policymakers want to hear from you. So I just, I hope at the end of this, that is what you will come away with more than anything, is a sense of confidence and responsibility, frankly, to get out there and bring your issues in front of policymakers. And if you guys are on the chat, question and chat box, there's a lot of really good information here about what folks on this call are working on in terms of their missions. So I'm going to provide just three really important takeaways for you all to think about when you're approaching policymakers. Any good interaction with a policymaker is going to have three ingredients. You have to actually go into the interaction knowing what you want. And we're going to spend quite a bit of time on this piece because it's actually where I see the most nonprofit organizations kind of falling down. So we're going to spend quite a bit of time talking about what you want and why it actually matters. And finally, this is the one that is intimidating. You actually have to tell policymakers about it. I'm surprised how often I find nonprofits that have incredible policymaking ideas and very impactful data to explain why their issues and their solutions are important. And then that little last step of actually going and talking to the people who can make a difference is intimidating, and sometimes it doesn't happen. So we'll talk about all three of these ingredients. I do want to take a brief moment here to note, because one of the very common questions that comes up is this legal? Am I going to get thrown in jail? Like, what are the lines around all of this? And I think, again, that fear is a real thing. I want to point out that I think it was shared with all of you in advance of this presentation, and also if you go to the handouts box, there is a handout there called Legal Infographic, and that's just a really short and concise explanation of what the rules are for nonprofit organizations as they engage in advocacy and lobbying. And I will give you a very quick, short snippet of what those rules are, with the world's biggest caveat being that I'm not actually a lawyer. I just have worked in this space for a long time. And I know some of you have state funding and federal funding, and sometimes there's extra strings attached to those kinds of funding. So you want to be really attentive to your sources of funding and how you're using the money. But broadly, as the IRS has set out, nonprofit organizations that are 501c3 public charities are able to advocate and lobby. So those are actually two different things. I think we think of them as being the same idea. Advocacy is a very general term for any kind of public education, anytime you're elevating issues for policymakers. Advocacy is a very broad term, and there is no restrictions from the IRS about what kind of advocacy nonprofit organizations can do. Lobbying is a more specific term, and it is much more clearly defined by the IRS, and there are restrictions around lobbying. So lobbying is the actual act of communicating a specific position on a specific policy to someone who can actually do something about it. So if I just generally, as a nonprofit executive director, am talking to my board about policy issues that impact our organization, I am in no way lobbying, because I am not talking to a policymaker. If I go and have a conversation with a policymaker and don't identify a specific policy, but just broadly say, gosh, we really need to support seniors in our community, they're really getting left behind in this pandemic, I have still not lobbied. I might be talking to a policymaker and I'm elevating an issue, but I'm not conveying a specific position on a specific issue. Now, if I go to that very same policymaker and I say, Senator so-and-so, I'm Jessica, I'm from the Area Agency on Aging, and I really want you to support policy 763 that's going to increase funding for senior feeding programs, I have now lobbied. So I think it's really important to understand what those lines are, and to some extent take some of the stigma and demystify them, because they can be really scary if we don't understand them. And in reality, the IRS has created a lot of ample opportunity for advocacy by nonprofit organizations. And I really, again, I think nonprofits have not just an opportunity to advocate, but a responsibility, because you better believe there's all kinds of people lobbying all kinds of policymakers about things, and if your constituents don't have a voice in the Capitol, which is potentially you, then their needs are not going to be met by our policymakers. Moving on, I want to talk a little bit about this question of what you actually want out of your interactions with policymakers, because like I mentioned, this is where things tend to fall down. I can say in my own life as a school board member and in all of my experience with nonprofit advocacy, we are really good. The nonprofit sector is really, really good at identifying problems. We could all sit here right now, I could have you pull up the chat box, and we could list hundreds of problems that our organizations are seeing or that our clients are facing. And that's not actually advocacy. Identifying problems is the easier part of the equation. What you actually need is to have a goal that identifies solutions. You need to have a lot more specificity for solutions than you might think. So I always take the example, I've done a ton of work around tobacco control. If I were to go to a policymaker with just a problem and say, oh, we have a lot of kids smoking cigarettes, this is a terrible problem, I want you to do something about it. The range of solutions that policymaker could come up with is wide. They could say, okay, we're going to pass a clean air ordinance. Or they could say, sure, let's try to really promote vaping. That'll get the cigarette usage down. Or they could say, let's outlaw all the cigarettes forever. I mean, there's a whole range of solutions that you could enact to address a specific problem. So when you will be doing your best advocacy is when you go to a policymaker with not just a problem, because we get those all the time, but also an actual solution. And again, the more specific and clear you are about your solution, the more likely it is that that policymaker can actually do something about it. The other thing I would say in this kind of Venn diagram of what you need to share with the policymaker is not just your goal of what you want to have happen, but also a specific ask of them. And the way that I think about this is that you know, a lot of times in the political arena, we think about who our target policymakers are, and there's some that we think are going to be with us absolutely no matter what, based on prior experience or what we know about them or what they said on the campaign trail. And then there's also some that we might think they're not going to be with us no matter what we say, no matter what we do. This is not their issue that's going to get them fired up. And then there's oftentimes some in the middle that you kind of have to educate and work with. I think it's worth going into any meeting with a policymaker kind of knowing where you think that individual is going to be and what kind of ask you might have of them. So the goal isn't just to go to someone who's your supporter and say, you're with us on this, right? I think you always want to be ready to ask for something more. So is it, can you please sponsor this? Is it, can you please tell us where you think your colleagues are going to be on this? Is it, can you identify who you think is going to be opposed and why you think they might be opposed? So I think it's always important to go into interactions with policymakers with a goal of not just telling them what you want, but having it be a little bit more interactive and a little bit more of a give and take. If it's someone who you think is going to be opposed to your issue, you still give them the chance to meet with you. I always say there was a policy I worked on years ago in Kansas City, Missouri, and there was one specific council member that I think we all thought, she's going to be opposed to this. Let's not even talk with her. And she rightfully so pulled us aside after we presented the issue and said, you didn't even meet with me. You didn't even give me the courtesy of a meeting. So even if there's people that you think are going to be opposed to your issue, you give them the courtesy of a meeting. Maybe the ask is, can you please just vote no, and you don't have to say anything more than no? Is it, can you please stay neutral? You really give every policymaker the chance to hear your case for your issue you're advocating for, and you always come prepared with something more than just what you want, what your goal is, but also what you want them as an individual to actually do to move your cause forward. And then I'm going to pull through a couple of examples here just because I think they help to illustrate this difference between how you really communicate what you want out of a policymaker. So I gave, and some of these might sound familiar to some of you because I think they're pretty classic for the nonprofit sector. I give this one a very technical rating of meh, oh, it's fine, it's okay. But if you go into a policymaker and you say, hi, I'm here and I'm advocating to make housing more affordable. Well, I have brought them a problem. Housing is too expensive. I have brought them zero solutions. I haven't talked about a land bank. I haven't talked about mixed use zoning. I haven't talked about any solution I'm actually bringing to their table. I'm just bringing them a problem. And they have a whole line of people bringing them problem in any given day. So the goal is to come in with more than just the like, here's a problem, I'm going to plop it in your lap and see what you come up with. So this is better. This is a better example. We want the city of Plainsville to adopt a net gain requirement for new development. So what I have done here is actually provided a specific goal. We want a net gain requirement for new development. I've brought them the problem and the solution, but I don't actually have a specific ask for this lawmaker yet, and we need to have both of those things. We need to have our goal and our ask. So the best we could do with this ask is to go in and say, we want the city of Plainsville to adopt a net gain requirement. Will you please sponsor an ordinance? Again, this is different. I have a specific goal. I have a specific ask of this individual. So hopefully the difference is clear of coming in and just saying, I want housing to be more affordable versus I want a net gain requirement. Will you please sponsor an ordinance? I'm so much more likely to get action out of the policymaker if I come to them with that level of specificity and a real ask in hand. So the next ingredient besides knowing what you want, which is a big piece of the list here, is actually being able to communicate to a policymaker why it matters. And there is this fun debate, I'm sure folks on this call have been part of it, of like, do people need data or do they need stories? Do we come at people with quantitative data or qualitative data? What's going to get the job done? And it's a fun debate, but I think ultimately the answer is you come with both things. You come with data and you come with examples of how this issue is impacting people. You do both things. And in the context of this conversation of how you make your case for your issues, there is a famous saying, you know, all politics are local. So I would say when we come to policymakers, we need to be bringing local data as much as possible and local people as much as possible. So if I come to a policymaker and say, nationally, 12% of seniors are food insecure, they'll have a lot of thoughts in their head. And one of the thoughts might be, well, that's probably mostly California. That's not here. That's not my community. But if I come to them and I have a similar data point for my own community, then they're going to listen in a different way. So we need to have that local data and local stories. When it comes to local data, I know that's so difficult to find sometimes for our issues. One thing I think that we don't give enough credibility to is anecdotal and like small data. So within your own organization, you might have very impactful data that is not necessarily nationally representative. It probably hasn't been through a gold standard review, but taking the issue of just hunger among seniors, if I come and say I run a food bank and we've had a 400% increase in requests for food over the last year, that data point is really, really strong. It's local. And it may not be in some peer-reviewed journal somewhere, but it will matter to a policymaker. The other thing that's important to have is just this demonstration that you have people behind you. So if I have one person come to me as a policymaker, I have exactly that. I have one person. I don't know if this is an issue that lots of people are concerned about or if this is one person's experience. It is hard for a policymaker to gauge how seriously to take an issue that is of a concern to just one person. But if you come and you say, I'm here as a representative of a coalition of 35 organizations who want you to do something around feeding programs for seniors, I as a policymaker now would have to listen in a different way because I know this person represents 35 other people. Similarly, you can really do a great job of elevating individual consumer stories. And again, they need to be local consumers, local individuals that you share with policymakers because that local piece is really important. So we're going to work through a brief example here. Why does it matter? We're going to do our same better, and best. So this is okay. This is fine. If I were really concerned about affordable housing and I went to a policymaker and said, in 2016, nearly half of U.S. renters were cost burdened. Again, I don't know for sure what the policymaker might be thinking on the other end of this interaction, but it might be something like, well, San Francisco has really expensive housing, but not here. Like, I haven't made the case that this is a local problem that they have to pay attention to. This is better. This is much better. And this goes back to that use of local data. Rental assistance is the #1 request made to the Plainsville United Way referral line. So now as a policymaker, I have to stop and think, okay, this is a local problem. This is impacting my community. I need to be paying attention to this. And best is when I really make this case that it's not just the data, but the people. So rental assistance is the #1 request made to the Plainsville United Way referral line, and that's why 45 organizations in our community have joined together to ... whatever your specific ask is. So hopefully the difference between these three is very clear. That local data and demonstration that you have people behind you matters so much for policymakers. Next, we're going to talk about actually talking to policymakers about your issue. And I am super firm on this. Other people may be a little more loosey-goosey, but I'm a big believer that you only provide a single page to policymakers. This page should cover what we've talked about of what you actually want and why it matters. Now, one page does not feel like a lot. It is not. The challenge is actually getting your case placed into one page of information. The reason I'm firm on this one page thing is because the reality of most interactions with policymakers, I'm sure folks on this call could share their own experiences, but they do not have a lot of time to give and they do not have a lot of attention to give. So most policymakers are dealing with issues all across our political world, all across our world. So I always say the Missouri General Assembly 2 years ago, their first 2 bills they passed, one was about who could braid hair, the second was about catfishing, and the third was the state's budget. So they're toggling between so many issues in any given day. And I think we assume that they know lots of things about our issues. They frequently don't. They're generalists. They're working across so many issues in any given day that you should definitely go into the interaction knowing that you are the expert, that 99 times out of 100, you know more about the issue than the policymaker does because it's what you live and breathe all day, every day. But you should also be prepared for the fact that policymakers are so stretched thin on their time that if you get 5 minutes of face-to-face time with a policymaker, you've just gotten a really solid chunk of time. So if you go in with a 30-minute presentation, you will undoubtedly be disappointed because at best you are going to get 5, maybe 10 minutes with them. I will say sometimes if you can catch them when they're in district, whether they're state senators or state reps or members of Congress, if you can catch people in district when they have more time, you can sometimes get more time with them. If you have them out to your facility, they love doing that. They love touring. You can get more time with them that way. But if you're actually going to DC or going to Topeka or going to Jeff City or going to the city hall, you're going to get maybe 5 minutes. So you need to be ready to make your case in 5 minutes or less, which is why I'm a big believer of this one-page thing. So here are a couple examples of some one-pagers. And again, we are looking for one-pagers that are going to address what you want and why it actually matters. So the first one here, the meh, is a journal article. I know that this is something we in our world enjoy reading. This is never going to capture a policymaker's attention. They are never even going to read it. So don't bring a journal article. Sometimes people will say, well, but what if they want? What if I reference the statistic in a journal article and they want to see the whole journal article? And to that, I say fantastic. It doesn't make you seem ill-prepared that you don't have it there to whip out. What it does is it gives you an excuse to say, I'd love to get that to you. I'll email it to you in a few days. And you've just gotten an opportunity to have another interaction with them a few days later and bring your issue back up and get it back on their radar screen. So do not bring something that's multiple pages long. I can't say that enough times. Do not bring a 10-page document. Even if you have one that's fantastic and you think they'd love, send it to them later if they're particularly interested. Bring one page. Okay, the second document here, I labeled it better. Visually, this is a lot more appealing. It all fits on one page. But what I don't love about this is that it does have some data, and some of it actually appears to be relatively local data, but it's all data. There's nothing on here telling me what this organization's actual ask is. They've just spent a lot of time and a lot of energy explaining a whole bunch of problems, and there is nothing about the actual solution that they want to see happen. Similarly, we don't know who's actually behind this. It appears to be just one organization. I, as a policymaker, would think, okay, here's one organization. They've provided me a lot of data. I don't know what they want me to do with it. I don't know who else is behind this. Is this just one group? How big of a groundswell of concern is this issue? But this last one I have labeled the best because it actually has, I really love at the top, it has all of these logos, and I get very clearly right out of the gate, I get the idea that there are at least 8 organizations who have come together in support of this policy proposal. I immediately have to take it really seriously because I can see that there's a lot of coalition support and a lot of people behind this issue. And then as you go down, you'll see one of the first things it does is actually specify a recommendation. Direct staff to work with stakeholders and the subcommittee to research and develop revenue projections from other local funding sources, working with stakeholders to determine the revenue needs for affordable housing. So very clearly, right out of the gate, it has given me the specific goals that they want me to do something on. There's not just a ton of data flying at my face. I actually know what they are trying to move forward. If you go ahead and read down, then you'll see that they have provided some local data around the scope of affordable housing in their community. So this one pager, again, is one page, just one page, and I understand at the end of it who the people are behind this issue. I understand what they want me to do. I understand the local impact of this particular problem, and I, as a policymaker, now have to take this, I would take this as a very serious policy request. So moving on, again, just going back to this, what will it actually take for you to do what your organization is intending to do? I know that getting to that specific policy ask can be really difficult. There are some incredible national resources out there. I think there's a lot of good value in just seeing who else is participating in this call and touching base with each other and comparing notes on what policy issues you're all working on. Medicaid expansion will be on the ballot on August 4th in Missouri. That's a great one to take on. But I think some of the hardest pieces of the work is really starting to know and identify what specific policy asks you're moving forward. But if you're really going to deliver on your mission for your clients and for your community, it's going to take getting to that level of specificity. The last thing I'll share before I toss it over to Marcy, just a little early, Marcy, so we'll have extra time for questions. There are a few additional resources on my website. If you'd like to check them out, it's platformcivic.com. That's where that legal infographic is. I also have a really great one-pager on 5 things you can do just today to begin making progress on your policy work. You could do them within an hour, just getting started, because I think sometimes this can all feel really intimidating and overwhelming, and just taking those first initial steps is really, really important. So with that, I will toss it over back to Lindsay so that she can navigate us through.
Thank you, Jessica. That was incredibly helpful. Next, we're going to throw it over to Marcy Phillips. Marcy is a Director of Public Policy and Advocacy at the National Council on Aging. She was responsible for federal advocacy efforts regarding legislation and appropriations affecting the Older Americans Act, economic security, hunger, older workers, elder justice, and other community services for older Americans. Before joining NCOA in 2008, she was a legislative policy analyst at the National Community Action Foundation, where she advocated on behalf of the nation's 1,100 community action agencies, and she served on the personal and committee staff of a member of the House Committee on Education and the Workforce. So Marcy, we're looking forward to hearing from you, and thank you.
Thanks, Lindsay. So I really appreciate the opportunity to speak with you all today. You know, I almost feel like I have less to share now that you've all heard about why and how you should advocate, but I really want to kind of reinforce some of the messages you've heard already, but also talk about some of the opportunities that our current situation is providing to us. So just to start, though, I want to give everybody a level set on what the National Council on Aging is. Hopefully some of you are aware of our work and what we focus on, but let me just share that the National Council on Aging is a respected national leader and trusted partner to help people age 60 plus meet the challenges of aging. We partner with nonprofit organizations, government, and business to provide innovative community programs and services, online help, and advocacy. Our vision is a just, caring society in which each of us, as we age, lives with dignity, purpose, and security. Our mission is to improve the lives of millions of older adults, especially those who are struggling. And that is translated into our social impact goal. We are aiming to improve the health and economic security of 40 million older adults by 2030. So when it comes to advocacy, one of the mantras that my public policy and advocacy colleagues and I always say is service informs advocacy. We are not a big lobbying shop. We don't provide political contributions to policymakers. We are nonpartisan. And we really rely on the voices of our partners throughout the country to make policy real to policymakers, to help them understand what the needs are and why the solutions that they're considering really will make a difference in their local communities. So that really means that we rely on your efforts to tell stories, to build relationships with policymakers. And in this time of this pandemic, and as we were talking about this training opportunity, my initial thought was, oh, we're going to have to remake the wheel. We're going to have to take on new approaches to make sure that voices are heard and that we can affect change in public policy, particularly at the federal level, and particularly as we engage local advocates. However, it's really become clear that the more things change, the more they really do stay the same. You know, I think that the area agencies on aging, senior centers, senior housing, other organizations that have found ways to continue to serve older adults as older adults' needs have changed and increased, yet they remain isolated at home, really is a proof point that the work can go on. The needs can be met. If we have a commitment to maybe invest in some new technologies, maybe change our approach, but the demands are still there, the needs are still there, and we can deliver. So in this presentation, I really want to focus on three core concepts. You know, how can you stay connected with policymakers in this environment? How have public policy priorities changed? I want to say that they've really been enhanced. We really haven't changed them. They've just pivoted in a few key ways. And how can we refashion the tools that we've already had on hand to make sure that not only older adults' needs are met, but that their voices are heard? So when it comes to staying connected, I really wanted to kind of compare and contrast certain advocacy efforts and tactics and how they've essentially pivoted in this time. You know, when national organizations try to mobilize grassroots across the country, a lot of times our first effort is to ask people to make phone calls and email their legislators. Well, that's still the case today. That really hasn't changed. Policymakers, staff are still answering phones. They're still looking at emails. And perhaps they have a little bit more time to look at those comments. And I would argue they're relying on that input more than ever. They really need to have a better sense of what's going on in their communities as areas remain shut down or public interactions at least remain limited. Town hall forums are also a great way to participate in learning about the issues at hand, but also how you can make a difference in those. You know, they've really been scaled back to a large extent, at least by federal policymakers, As policy debates have gotten more heated, I would give the debate around healthcare reform as one of those examples. And some of them have already pivoted to virtual opportunities to still reach out to constituents, largely to talk about what they have to offer on a certain topic, but also theoretically to hear input from constituents about those issues, the needs that are in the community and ways in which they should be addressed. So I feel like now is a new chance for people to really get engaged with those town halls, whether it's a phone town hall, whether it's a video town hall. And the easiest way to learn about them is to make sure that you're signed up for newsletters, or that you follow the social media of your elected officials. They are certainly broadcasting them more than ever. There is an organization called Town Hall Project. They have a website with that specific URL, and they track these town halls on a regular basis. So that's another way that you can get connected. Those of us who work in Washington, D.C. and do national advocacy, we often organize Hill Days, where we ask advocates to come to Washington, D.C. We send them up to Capitol Hill and visit with their members of Congress. I know that is a common tactic that happens at state capitals, so hopefully that is not something that is new to you. But more and more, we are looking at virtual advocacy day. And I have to say, from the National Council on Aging's perspective, this isn't exactly a new tactic. A lot of our partners don't have the resources to actually travel to the Capitol unless they are making a visit to Washington for some other purpose, hopefully a conference or some other opportunity. But we've looked at virtual advocacy days as at least the means in which we can mobilize advocacy on a specific day, so with focus on specific topics. And it's largely been asking people to leverage phone calls, emails, or social media in order to make their voices heard. But now that more and more organizations are using video and video conferencing, that is a whole new arena that would allow engagement around a specific day and a specific list of policies that need advocacy. And we'll get into that and how that's deployed in a few minutes. The thing that really intrigues me are the opportunities that could be there around site visits. National Council on Aging has a membership entity called the National Institute of Senior Centers. And particularly in years such as this, an election year, we always work with them to respond to policymakers that are up for election or re-election. They know that older adults vote, and they often come calling to senior centers as a natural place for them to engage with voters. But more and more, as those senior centers pivot to being virtual centers or centers without walls, as older adults remain at home for longer periods of time, we want to look at the opportunity of doing virtual site tours. I've heard this from other lobbyists who represent corporate entities, and they look at those photo ops and tours where a policymaker might tour a local factory. I think that we should track what they do and take some lessons learned, so that maybe if a senior center's closed, they are on site when there's a meal pickup. They perhaps have some conversations with those that are doing telephone check-ins, or they tune in to some of the virtual classes that are going on. Those are just some of the things that I think can make a huge difference and would be more accessible for everybody. It wouldn't be as heavy a lift to create an event, and a policymaker and their staff would have better access without worrying about logistics and how to get there and so forth. Media is still your ally. I'm hoping that many of you are connected to local media entities. You can either have the opportunity to write op-eds or letters to the editor, or maybe you have a relationship with local editorial boards. Using media to leverage your story, to raise the visibility of your organization, are key ways. Members, at least on the federal level, get regular updates about what's going on in their communities and what's being printed. And that is a really key way to get your message across. I would even add newsletters to the extent to which that you communicate with either local other organizations or older adults themselves. Make sure the policymakers are on those lists as well, so they understand the work that you do. They know what events are going on. When I worked for a member of Congress from California, our district office staff were often working from 9 a.m. to 9 p.m. because they were visiting organizations in the district that were having events throughout the evenings. Media now, a lot of it is social media, which isn't surprising, but it gives you more of an opportunity to get your message to a larger audience. It also allows you to kind of leverage messaging that other people are doing and making sure that your perspective is part of that debate. And again, we'll get into that in a few minutes. Ultimately, it is also about storytelling too. And I've provided some hyperlinks about how NCOA's storytelling is pivoted. We have a written story about Patty and how the Senior Community Service Employment Program really changed her life, how it got her back on her feet, got her a new job, and enabled her to make ends meet and not worry about her future. But now we are more and more using video in order to tell stories, and the support communities video is really focused on the work that the Aging Services Network is doing right now to meet the demands that older adults are facing. And all of these are about relationships. As a national organization that works with local partners, our best asset is the ability to go to a member of Congress and talk about the organizations that are serving their older constituents and leverage their expertise about the needs that are in their communities and the solutions that will best address those needs. We can give all the national data points about falls and falls prevention, about older adults who don't have the access to benefits that they deserve. But until we are able to say what the lack of access means to older adults in local communities and the difference once those connections are made, our advocacy at the national level is very much limited. And we're very sensitive to a lot of the barriers that some of you may face to doing advocacy, particularly when it gets into the lobbying arena. A lot of our partners that we rely on are organizations that get federal funding to deliver certain programs, so they have that additional layer that they have to consider when they are driving home that ask. So, hopefully some of you are already partnering with us, but I hope that you, feel an opportunity to work with us to translate some of this expertise, some of this storytelling into a means to drive home and ask at the national level that really could influence public policy. And we'll get into those opportunities as well a little bit later. So what are some of the new technologies that are being leveraged? It's probably of no surprise that any of the means that now exist to do group meetings are great ways to leverage advocacy, whether it is enlisting a member of Congress or whether it's educating other like-minded organizations that might join you in advocacy, to educate them about why they should take action and the ways in which they can really make a difference. So I've heard other advocates at the national level mention any and all of the platforms that many of us are using to a larger degree, whether it's Zoom, Google Meet. I've heard that members of Congress are actually using Google Hangouts themselves to get in touch with their communities and stay in touch with advocates and other constituents. Skype, GoToMeeting, WebEx, etc. This is probably a new and increased opportunity to leverage the social media tools that are out there. As at the federal level, we do know that there are concerns about the security of some of these web platforms for video meetings. So we've heard some talk about the opportunities to use Facebook Live to at least have that video engagement, able to talk to policymakers beyond just a phone call and have it feel more substantial. Twitter storms are still opportunities, or thunderclaps, to amplify your voice, to really make drive home the case that there are many advocates who are identifying a problem and are behind a specific solution. You've seen already some examples of the power of approaching a policymaker with a number of organizations as part of a coalition, whether it's a sign-on letter or that one pager. You can do that in the same manner using social media. YouTube Live is also providing another opportunity for face-to-face engagement as well. And then, the traditional, as I mentioned, the traditional phone call and email are still very viable options, as well as petitions. Again, showing the strength in numbers. And you will find more and more online platforms in order to leverage that. For instance, national organizations, and I know this is happening more and more on the local level, will provide websites in which it makes deploying a phone call or an email with a consistent message that much easier, and making sure that you're reaching the right people. The same is true of petitions. And just as I was doing research for you all about some of the other opportunities, I mentioned Google Hangouts, but FaceTime and WhatsApp and one-click.chat are also ways in which to have that live engagement with other advocates or with policymakers. So what are some of the priorities at the federal level that we are now following, and in which we could really use your help and your voice in order to make a difference? The debates that either were ongoing this year or continue. Earlier this year, we finally passed the reauthorization of the Older Americans Act, and I'm very well aware that a lot of AAAs probably haven't been hearing from N4A and other entities about the importance of that reauthorization. We need to think about the successes in that legislation and what it means for the regular appropriations process. I know there's been a lot of news about the vast amount of dollars that are going to aging services in the midst of pandemic relief, but we have to be mindful that there's a regular appropriations process that is almost halfway completed in the House at this point. We have to make sure that the funding available for congregate meals, home delivered meals, supportive services, supportive housing, energy assistance, are all going to be available come the new federal fiscal year that starts on October 1st. And there's still the need to make the case about the importance of those investments. The pandemic debate has all been about the emergency, either the huge growth in numbers or the new needs that are emerging. But we all know that aging services have been chronically underfunded and for a long time. So we have to make sure that those base investments are also being made. Congress continues to extend a number of health programs, and the one in particular that I wanted to call out was the legislation that provides investments for a number of aging service providers to ensure that low-income older adults have access to various benefits. For instance, low-income subsidy for Medicare, SNAP, energy assistance. So, you know, as I mentioned earlier, there is a chronic underrepresentation of older adults in those programs. Many are not getting the help that they qualify for, and making sure that benefit access is available to low-income older adults is crucial. The Congress has kicked the can down the road once again and extended those programs through November, but at some point we need to get those finally authorized and hopefully get some funding increased for those efforts. And before the pandemic, Congress was looking at trying to tackle prescription drug costs. You know, we may see that emerge as part of the debate about the struggles that people are facing to make ends meet. And we know that healthcare costs are a huge burden, particularly for older adults. So don't lose sight of that debate as well. So what have we added to our plates? Well, as I mentioned, that pandemic relief, we've seen a couple of bills already enacted that would provide additional resources, particularly for those programs that provide hunger assistance. You know, the Meals on Wheels, the home delivered meals, congregate meals have received increases, and there's been flexibility to pivot those dollars to serve older adults at home. More resources for supportive services, for elder abuse protections, for protections for older adults in nursing homes through the Ombudsman program. All of these have received some investment along the way, but we're already learning that it's not enough. Again, due to the chronic underfunding, but also, as you know, was mentioned earlier, the struggles that are being faced now by state and local policymakers as they are mandated to balance budgets and often take up the slack when the federal dollars don't go far enough serving Americans in emergency times such as these. So the next wave of pandemic relief certainly has a lot more to do with respect to state and local relief. Among the National Council on Aging's priorities is increasing FMAP, as well as getting more resources for Medicaid home and community-based services. We also have been right there along with a lot of the anti-hunger groups advocating for increases in SNAP benefits. If they increase the maximum amount that's available as well as the minimum, that would make a huge difference for food insecure older adults. Many of them don't apply because they think they're only going to get a few dollars here and there to buy groceries. Those programs have also pivoted to ensure that older adults can get those meals delivered, get those food items delivered, just as they do meals. So that is an important policy change as well. And we need economic stimulus across the board. We know that a lot of these public benefits actually provide dollars for middle and low income older adults, and they will help the economy. But there are many ways in which the federal government needs to step up with state and local relief and extending and improving unemployment insurance benefits, providing assistance to the Senior Community Service Employment Program, the only federal program that provides job training and placement assistance to low-income older adults who are looking to return to the workforce. And, you know, being very mindful that many Americans are now relying on virtual delivery of services. Telemedicine is, you know, one of the things that come to mind. We've got to make sure that broadband is widely accessible and that we bridge the gap in the digital divide, not only to bring that internet access to every community that needs it, but also to make sure that they have the tools and the resources, the hardware to access it. So there's still a lot of work to be done. The House passed legislation a month ago looking to make more investments, known as the HEROES Act. And the Senate is returning on Monday and has a target of getting everything done and wrapped up in 3 weeks. So we need a lot of advocates at the local level to be applying a pressure to make sure that they get their work done before another recess comes up in August, and make sure that those needs are addressed. You know, we hear from a lot of policymakers, well, I didn't make it a priority because nobody came to me and talked to me about it. You know, I'm not hearing it back home, and that's where your role comes in. So how's NCOA refashioned some of our tools? We've always had an advocacy toolkit that has a number of resources, both from the basics of best practices of communicating with Congress, storytelling, just understanding how Congress works, so you know how to influence the debate. One that is a perennial piece of that toolkit is our federal budget toolkit, where we speak about where the federal budget is in its process, where members of Congress have stepped up, particularly around funding for the Medicare State Insurance Assistance Program, for falls prevention, for chronic disease self-management, for Older Americans Act generally. And then what would be timely ways for you to make a difference? You know, is there an action alert that we've deployed that you can use to write to your member of Congress? Are we doing a story collection event? Are we working with other national organizations who have the same priorities as we do to sponsor a Twitter chat? Ways in which you can get more involved. And we have our action center, as a lot of organizations at the national level do. We have a standing place where you can look for those opportunities to add your voice, whether it's through email or phone calls, or even commenting on pending legislation. So how will we reshape those tools? Well, most importantly, we've created an advocacy toolkit around our most pressing advocacy needs when it comes to responding to the pandemic. And as I mentioned, those are related to FMAP, to SNAP/food stamps, to the Senior Community Service Employment Program, and for health promotion and disease prevention in the Older Americans Act. Many Older Americans Act programs have received investment so far, but one of the pieces that is missing is resources for those evidence-based health promotion and disease prevention programs, so that not only are they available to help older adults remain safe and healthy in their homes, maybe they aren't going to see the doctor as often and they have chronic conditions, maybe they haven't fall-proofed their home yet, and we don't want to see an explosion of health problems as once they're able to finally emerge and be more engaged in their communities. And those who deliver those services need the technology investments and resources in order to disseminate them. We are very sensitive to that. So those are some of the priorities that you can find in our toolkit. We've created a means to collect stories with respect to the pandemic. We are doing a lot of work to promote the ways in which the Aging Services Network is stepping up. But we really need more of those stories to really talk about the ongoing needs and what those realities are. We like to tout success stories because it tells policymakers that their investments are making a difference. But we also have to continue to identify those gaps. Being that it's a significant election year, we added an election center to our Advocacy Action Center. And it provides opportunities for people to look up the rules governing elections in their states, which is more important than ever as questions remain about voting in mail versus voting in person. Learning about who those candidates are. Those are either current policymakers or ones that you should start to develop relationships with now, so that once they do make it into office, you're able to engage with them on a regular basis. And as our colleagues looked at ways in which our partners across the board were pivoting as they tried to go about offering their services on a fairly normal basis, or to keep themselves organized and running. We assembled a number of tools for reaching a remote audience. So it speaks to a lot of the platforms that I've mentioned already, but it also provides some pluses and minuses about some of those platforms. So for instance, what's free versus what requires a subscription, whether any of them have participant limits, whether some of them are better for fitness classes versus meetings or forums. So hopefully you'll find all of those resources to be helpful. So I know I seem to have added to our time for Q&A as well, but really want to just emphasize too, please keep in touch. Hopefully you've noticed from my bio that I've been working in advocacy for a number of years, and it's always been with nonprofits, particularly nonprofits serving vulnerable populations at the community level. So I'm really sympathetic to all of the challenges that you have to do your work day in and day out, often with a lack of resources. And I'm very sensitive to when some national organizations such as NCOA send out urgent emails saying you need to act now, that doing so often is a huge challenge. So I really want to be a continued resource for all of you as you try to maneuver some of those new realities, and really try to not focus so much on what the barriers are, but again, what some of the new opportunities that are in front of us, and ways in which we can continue to make a difference. It's just amazing the ways in which so much of the dialogue now seems to be about returning to normal. And when it comes to older adults, particularly those who are most vulnerable, I don't know if the reality is ever going to be the same. And at least for the few months ahead of us in this calendar year, there's a lot of work to be done to make sure that older adults can remain safe and healthy and independent. And we will continue to work to be a voice in that arena at the national level, but we certainly want and need to partner with organizations such as yours to make sure that we are, telling the right stories and identifying the right solutions, and that once those solutions are deployed at the national level, they are really making a difference at the local level in the ways they are intended. That's going to be also part of the debate. So, I've also provided a link here for ways in which you can sign up, and also ways in which you can continue to follow us here at NCOA. So thank you very much.
Thank you, Marcy. I really appreciate both you and Jessica taking the time to speak to us today. We're going to open it up to some questions now. Again, for those of you who do have questions, go ahead and type those into the questions box. And if you have, if there is a particular person you're directing that question to, if you could just indicate which person you're asking the question of, and then I will direct those questions to our speakers. So I'll go ahead and get started. It looks like we already have a couple questions typed in here. The first one being, we are a staff of 4 and our advocacy efforts are sort of knee-jerk with an email or phone call. How do we become more organized and consistent with advocacy efforts? So I'll open that up to either or both of you to answer that question.
Well, Marcy, you're welcome to jump in too. I think that one of the things I believe is extremely helpful is spending a little bit of time. I think fall is a great time to do it because you've typically gotten through your state legislative session, and there's usually August is a good lull for federal work, but take some time in August or September to actually think about for the upcoming year what policy goals you intend to pursue. Spend a little time really thinking about which level of government has the authority to make those changes, what kind of relationships do you have with folks in those offices, and put pen to paper. I think there's some really incredible value in actually taking the time to write down and share with your board what you're planning to work on a policy front over the next year. You don't have to stick to it. Obviously, something like COVID, nobody had that on their policy agenda for this year, but you have to have some flexibility, but I still think it's a really valuable exercise to understand what you're focusing on and really spend some time doing a little bit of political analysis around that issue of where is it for policymakers, where is it for your organization, how knowledgeable are your constituents about it, and going from there. But that little exercise of spending 2 to 3 hours really focusing on this can go a really long way.
Yeah, I'll just add, maybe it'll make you feel better that we're a team of 2.5 at the national level. I focus on the programs that are funded on a regular basis, those called discretionary programs. Howard Bedlin, our vice president for policy and advocacy, focuses on the mandatory programs like Medicare and Medicaid. We have a colleague who focuses more on the regulatory side, but he is not paid to do any kind of lobbying. So we rely on other colleagues to kind of help put the pieces together around the organization, but we also rely a lot on coalition. I totally agree with Jessica about finding that downtime to make the plan and really thinking through that so you have those goals, but it's all sometimes about the first step. As I mentioned, sometimes it's storytelling and relationship building. And maybe you think of some of those things that you can do that you already do regularly that can make a difference, like sending a newsletter to an elected official. Maybe it is, getting more involved with this group and ways in which you can leverage your voice so that you're prepared to share your message, but maybe somebody else is figuring out the when and the how. But so those would be some of mine. I have to say, we rely a lot on coalition. We recognize that we can't always get our message across or the work done unless we're working in tandem with a lot of our other colleagues.
Great. So Marcy, this next question is for you. Can you please tell us again the name of the Senate bill to address digital access?
Oh my gosh, there's quite a few that are out there. I don't have the names handy, so I will do my usual advocacy hat where I'm not going to try and fudge the answer. I wouldn't do that with a Hill staffer. I would say, let me get back to you on that and make sure that I give you a detailed answer. So you got my email address, and I'm happy also to share that with Lindsay and Kathy, and they can pass that along, because I think that's going to be our next wave of advocacy for sure.
Okay, and just as a reminder for folks, we'll be sending around a follow-up email with the webinar recording, but we'll also include in there any other follow-up information that we need to provide, whether it's names of bills or other things that people have asked. So the next question, and Marcy, I think you've already answered this to some extent, but I'll take it a little further. The question is, how do I sign up for advocacy news and alerts? And you've already talked about how to do that for your organization, but I'll throw this question out to both of you. Are there other organizations, whether it's local or national organizations, that you think people should be aware of and be able to, whether it's signing up for alerts or going to meetings, whatever it is, what are those organizations that you want to throw out there to make people aware of to help them connect with advocacy?
At least when it comes to policy, I think a great place to start, if you're not affiliated with some of the national organizations, is peruse the website of the Leadership Council of Aging organization. It is really easy to remember their address. It's lcao.org. And there are currently 69 national organizations that are members, and you can find one on just about any topic that might be of interest to you. So I would, recommend either signing up for their newsletter or following them in social, and you can really learn a lot of tips. And I know that Jessica's got some great ones that we both like when it comes to advocacy, so I'll let her take that.
Yeah, I mean, I think that the wonderful thing is that there's a lot of national court consortiums of advocacy groups from around the country. So things like State Policy Priorities, Center for Budget and Policy Priorities, Partnerships for America's Children. There's a lot of groups. You can find so much by Googling, and a lot of those groups do the hard work of tracking specific pieces of legislation and issuing action alerts, and you can kind of ride on that. The Alliance for Justice has a project called Boulder Advocacy that offers a lot of really great resources. A lot of those are focused on sort of the legalities of advocacy, but generally I am always amazed by what you can find out there on Google, and you're most likely going to find some organization that focused on what you're focused on and doing that sort of under the dome inside baseball work that can help feed information out to you.
Okay, so the question we have, how can we get seniors connected who can't afford the computer, iPad, etc., can't afford that technology that they need to be able to connect?
That's a great question. So the tool that I provided in my presentation not only has resources about how organizations can connect, but there are some opportunities to get access for older adults, whether it's tablets or whether it's the connectivity themselves. I think a great resource is Senior Planet. They have training as well as tips and resources, and we've been relying on them a lot. There is another organization, I think it's the full name is Older Adults Accessing Technology, but don't quote me on that. If you look up OATS, OATS, So yeah, I already messed up the name now that I think about it. But Oates is one of the leaders as well in that space. Um, the Lifeline program has been a longstanding one that's been out there, not only for older adults, but just low-income Americans generally, that traditionally provided access to phones and phone service, but has now expanded into broadband. And that is some of the debate that we're having now, is trying to expand access to that Lifeline program. We found that low-income older adults who were using it either to access some of the services provided by AAAs and others were running out of minutes, and then others just haven't gotten them yet. So those are some of the ones off the top of my head, but that's something we can definitely follow up with as well.
The other thing I don't know if this question is quite in particular to like how you can connect seniors directly with their policymakers to advocate, but I think we tend to think in the policy world, that you need a ton of volume, that it's going to take 1,200 phone calls or hundreds of emails, but you would be amazed how far one phone call and one email can go. So I wouldn't rule out the possibility of, helping do a three-way call with some of your clients so that they can connect directly with their lawmaker and explain the importance of whatever it is you're advocating for. I think a little can go a really long way on some of this stuff.
Okay, our next question is around planning Zoom meetings with state legislators. So do you have any pointers on how to arrange those and best ways to schedule them? Or just general input on how to set up the call so that it's effective?
Sure. I mean, I would say one of my favorite times of the year to do things with state lawmakers is typically going to be like September and October. Granted, with COVID, those are looking like really busy months for people, but I think one of the best things to do is to catch them before they have gone back to Topeka or Jeff City or their state capital for their legislative session. You want to be a couple months prior to their legislative session. That gives them time to hear what's on people's mind. If there's something that really captures their attention and they want to pre-file a bill on it, they have time to do it. So I like that timing. In terms of time of day, I think there's like no magic ingredient for what time of day you do something like that. One thing that I think is just really important to include regardless is making sure that there's some room for some back and forth. So it's not just a chance for policymakers to talk to your people about what they're doing, but also finding some way to have some of that interactivity so that they can hear directly from the other people on the phone, because that's the way that your issues get elevated onto their radar screen. So you want to take that opportunity to make sure that it's not just about listening, but also sharing with the policymaker what you want to see them work on.
Yeah, and I would just add that it's the same tips apply with respect to kind of organizing your thoughts for an effective meeting, whether it's just you or a group. The only thing that's really changed is the medium. And that's, you go in with a plan. If there's a group of you, you go in trying to figure out who's going to say what and when. And as Jessica mentioned, you're still going to have to keep it quick. It might not be the 5 minutes that you're going to get, when they're at the legislature, but you're still going to have to be mindful of time. And understand too that picking the platform will probably still be up to the scheduler. And I'd add the caveat of Zoom, because we know that U.S. Senate staff won't use the platform. They are too worried about the security. I mean, they'll use it as a phone option, so you can still do the conference call, but the whole point of doing the video will be lost because they're nervous about the security protocols there.
Okay, so the next question I have is one of the documents ahead of the webinar. And actually, I'll take a minute. I forgot to mention this earlier. Anybody who doesn't have those documents, the slides, the handouts from the presentation, you can access those through your toolbar. They are under, I think it's a tab called Handouts, and you should be able to access those documents and the slides from the presentation through there. But the question is, One of the documents shared ahead of the webinar noted that a good way for private foundations to work on advocacy efforts would be to offer training to grantees on lobbying and advocacy. Do you know of some good training programs? We are in northern New Jersey and work with a coalition of age-friendly communities that make up a powerful group of about 35 people who share advocacy goals. Other groups would probably join in as well.
So I worked for a foundation for years doing this, working with organizations that we funded to help them elevate their own voices around advocacy and policy. So it's certainly something I have experience with. I would tell you from being in that role, one of the really important things to think about is twofold. One is that not all training is created equal, and identifying what the specific kinds of training are that is necessary, and they're different for different people within an organization. A lot of times boards want to know the legalities so that they don't have an organization that gets in trouble. Staff oftentimes wants to know more on the implementation side. How do we do this and do it well? So I think some of that is catering to your audience and really identifying where your field of advocates is and what training they actually need. The second thing I would say is that there's a lot of really good research that the best way for organizations to build their advocacy muscle, and this is probably relevant for private foundations, but also everyone on this call, is becoming a great advocate. It's kind of like exercising. Like the more you exercise, the stronger you get. So the more you advocate, the better you get at it. So it's not so much a matter of sitting down and watching 8 hours of webinars and then going off and doing it. It's partially a matter of obviously watching this webinar, but also starting to experiment with it and try it and learn from it and debrief and really reflect on what's worked and not worked. But really a lot of what we know is that the best way to become an excellent advocate is to just start trying and iterating and changing as you go.
Okay, so I think we have one final question from the group, and then I'm going to follow up with a question as well. But the last question we have is related to the number of legislators that are often covered by different service areas. So, you know, many of our AAAs cover multiple counties. You know, the person here is saying they have 64 legislators in their service area. So do you have advice for people as they're trying to narrow down? They can't build effective relationships with 64 people necessarily, but are there ways they can narrow it down and target those relationships to be more effective?
So I can take a little stab at this, which is, this was similar to where we were when I was at the Health Forward Foundation. We actually covered 2 states and 6 counties and 97 municipalities. So if I ever were to sit down and say, who are the elected officials representing our service area? It was a list 400 people long. Some of that, if you're speaking just about state legislators, is really identifying who's in leadership roles and who's on committees that are most relevant for the work that you're doing. So if you're tackling a lot of issues that are going to be handled by a certain committee within the legislature, take that list and compare and contrast, you know, who within that committee is actually within your service area, and focus your relationship building efforts there. Also, as you get to know lawmakers, you start to have a sense for, like I said, you know, there's this group of people that are typically going to be with us on the issues, and they probably don't need you to have a whole bunch of meetings with them to get them to that place. So don't spend your effort there. But there's typically some lawmakers that are more your swing lawmakers who are going to be persuadable, and that's, once you can figure out who those are the ones you'll probably want to spend most of your time focusing on. Don't discount the rest, but those are who you'll focus your time on.
Yeah, I'd say the same is true at the national level. There's no way that we're going to lobby 435 members of Congress and, you know, all 50 senators. It's not a good use of our time, particularly as we are a small shop. And same approach. We look at leadership and committees, and then, which is why maybe those of you in Missouri hear from us more, because you've got a key appropriator from your state. But at the same time, we always look for those relationships, which is why we're always trying to get more information from those we work. Maybe there is a member who has a history or a passion for some of those issues. We don't want to leave those behind either. There's always a surprise when you're trying to recruit and really grow champions. Sometimes it's not always the people on those key committees, and you don't want to leave them out of your advocacy efforts.
Okay, so I don't see any more questions from attendees, so I'm going to close things up with a question from me. Oh wait, I saw one more question come through. Hold on. What is the website Marcy gave for advocacy newsletters? Can you say that one more time? lpao.org.
Leadership Council of Aging Organizations, so LCAO.org.
lcao.org.
We'll make sure you get it in a follow-up email too, because we both threw out some other national organizations you might want to keep in touch with, so we can add to that.
Okay, so the question that I'll wrap things up with is I'm going to ask the same question to both of our presenters, and that's, if you had to pick one issue that you want to make sure everyone knows about that is the most urgent right now, what is that issue and what can people do right now?
I'll give a very shameless plug, and it is maybe not super relevant for every organization on the phone, but I think it's relevant for everyone, at least in the state of Missouri. I would go to yesonto.org. There will be, in less than a month, a constitutional amendment before voters in Missouri to expand our Medicaid program. This will extend access to health care to more than 230,000 Missourians and bring about $1 billion+ tax dollars home to the state of Missouri. For folks that work in aging services, it just generally is going to support the sustainability of our hospitals throughout the state. We've lost 13 rural hospitals in the years that we have chosen not to expand Medicaid. So that is right around the corner, and there's a lot of really specific resources out there that you can use to support the Yes On 2 campaign. So just a shameless plug there.
And as a reminder, that's August 4th, is that right?
Yes On 2 on August 4th, yep.
And I'd have to add the Medicaid pitch as well. I mean, if we look at everything and what's going to make the biggest impact, it's those resources. So while we are cheering along with you all and hoping that your state expands, there's also work that needs to be done at the federal level to expand FMAP. They've done a little, but they need to do more. And they certainly need to do more when it comes to expanding the percentage for home and community-based services. They were both in the HEROES Act. And whether you want to make the case for the health of low-income Americans, you want to make the case for keeping older adults healthy and independent, and individuals with disabilities with home and community-based services, or you just want to make the case that your state needs more resources, those hit all those buckets. And I think, I personally, I'm the person who would say Older Americans Act, Older Americans Act, Older Americans Act. But I am realistic about in terms of how far that money really goes. So that would be my pitch as well.
Great, and I'll just for the Missouri folks on the line, I'll let you know, with that enhanced Medicaid match, the level that they're talking about right now, that would bring an additional, I think it's $1.8 billion into Missouri. And to be clear, that doesn't just protect programs funded by Medicaid, that frees up funds to be able to protect services that are funded out of general revenue. So if we can bring in those enhanced federal dollars to kind of fill those gaps in the state budget that we know are going to occur, and that protects all those other programs that are funded through the state budget. So that's really, not just helpful for Medicaid, but also helpful as a general budget stabilizer as well. So, first of all, I want to say thank you so much to our presenters for taking the time to talk to us today. That was incredibly helpful information for everyone. As we've already said, we're going to be following up after this with the recording of the webinar, and we'll also be providing lots of resources to attendees and be able to point you to some of those organizations we've already talked about, whether it's national organizations that do have advocacy surrounding older adults, also some local organizations that you can connect with to help connect you with legislators and issues that may apply to older adults. So we'll be following up with that information. We're also going to be having a survey following this to help you give some input on how the webinar was and what issues might be were particularly helpful to you and what issues might be helpful for you to learn about in the future. So expect that survey as well. The last thing I want to do before we close down is let you know about a new advocacy initiative in Missouri that's specifically focusing on older adults that you can connect with, and it will be helping to connect organizations who serve older adults across the state. And that's the Future of Aging initiative. It's a statewide coalition in Missouri that's currently funded by the Missouri Foundation for Health to advocate on behalf of older adults for policy and systems change. The coalition is supported by the Missouri Association of Area Agencies on Aging and the local area agencies on aging, with leadership from an executive committee that's comprised of funders, advocates, and researchers from different parts of Missouri, including representation and collaboration with people from lots of different areas. So there's advocates, service providers, and academics, and people from lots of different areas who are serving on that executive committee. And right now, this group is working on expanding the coalition. So they would love for other people to be part of this coalition. They're going to be doing a needs assessment with surveys and virtual listening sessions for service providers and advocates to come up with a shared agenda for advocacy and systems change in Missouri. Those of you who have an interest in being part of this effort will have the opportunity to do so. Catherine Edwards is leading this initiative. Many of you are already familiar with Catherine from her years of service at MA4, and Leslie Schuler. They will be following up after this webinar with an email to let you know how to connect with that initiative. And that's really something that's relatively new. There have been lots of organizations in the past that have advocated for older adults in Missouri, but this is one of the first that kind of brings all of those organizations together in one coalition. So we're really hopeful about that initiative and the potential it has to help older adults across the state. So again, expect some follow-up from us. I want to give, again, a thank you to our presenters. Another thank you to the Leaders in Aging Network, and particularly Kathy Boyer-Sheshal for organizing all of this and doing the behind the scenes work. I also want to thank our sponsors again, AARP Kansas, AARP Missouri, and the KC Communities for All Ages Coalition. And finally, I want to thank all of our attendees for taking the time out of their day to listen to these great presentations. So thank you to everyone. Look for an email from the Leadership in Aging Network moving ahead to connect. And otherwise, thank you for attending and have a wonderful afternoon.